We're going to start with the arch taping. This one, it is very important to spray because the ball of the foot tape doesn't stick very well. People sweat a lot. So we want to make sure it sticks. Arch tape jobs can be one of the best tape jobs you do, or it can be the worst. If it does not stick, it probably would be the worst, cause a lot of blisters, and cause them more problems. All right. In class, you are probably going to have to use your tape and tear it in half. All right, because we want 1-inch tape for this. So this is actually a 2-inch roll that I tear in half, and that works fine. If possible, it's better to actually get the inch tape. It actually is a little bit more stronger and a little bit more adhesive, so it's going to stick better. Now we want to go up to what we learn as the ball of the foot, as the metatarsal arch. And the anchors are the most important thing. Now we're never going to tape all the way around the foot, but that anchor, make sure you get that on there and make sure that is sticky. Do not pull things too tight. If you pull things too tight, that's what will happen. You'll get these little creases in here. That's going to be very, very uncomfortable. All right, so you do not want those creases. We're just laying the tape on here as an anchor. So you need at least 2 anchors. We never want to go above these anchors with the rest of our tape. So we're going to kind of do X's across the arch, and we're trying to support the medial longitudinal arch and the plantar fascia, which runs right here, if you're not ticklish. We're going to start at the big toe, X around the Achilles. Now you don't want to get too high up into the tendon, but you don't want it too low or it'll slide off. And then we're going to come up, and whoops, I already went above that. All right, and we're going to go across the foot. So then we're going to move over here. And it's important to then X and go across that spot. We just want to cover the whole area across that foot. And we can also come and do one off the 5th metatarsal, coming back around. All right. And I'm going to do a series of 4 to 5 of these X's, so that I have them across and cover that whole foot. Now to fill that in, for comfort, sometimes I'll do what we call a low dye strip, which we just start here and come straight around the foot. That's really helpful if they have soreness in the arch right here. So I can do a couple of those. Well, that's not required when you're going to test out at the end of the year. And then we're going to put anchors on. Right now, when we get to here, we're going to always want, again, to start on the lateral side and pull up on the medial side, because we're wanting to support the medial arch. And once again, she's doing a nice job of keeping her foot up for me. So we're going to start on this side. Once again, we're overlapping by a half, and then here we kind of pull up. Pull up. And I'm doing this about half. Another way to do it that I usually do is pulling up here, and then I just tear it here. It's just a lot easier. We're going to go down to the heel. I'm pulling up there and just laying it down. Now, 2 things you can do to help this stick. If you have non-elastic tape, we can use that. If you don't, you can place then half strips here. All right, which might help that stick. Because sometimes if I have you step down on that, and I always want you to step down, let your partner know how that feels. This is what happens sometimes, it'll pop up. So you got to make sure all of these anchors are stuck down there. So you don't want to tape it too tight, because as you step down, her foot flattened out, and if it's too tight, it's going to make it more uncomfortable. So hop back up there once. If we have elastic tape, and we won't use it in class, but this really helps secure that whole area on there, and it's much more comfortable, and that way we make sure nothing is going to come off.